100 years ago, Columbia University made the decision to create one of the first 3 schools of public health in the United States. The move was a response to the nation's increasing need for professionally trained public health workers and was rooted in a deeply held commitment to looking out for the marginalized and the underserved. It resulted in the creation of an institute that began in a single room with a single student in a building on West 59th Street. Today, the Mailman School of Public Health is a thriving Columbia institution. It has educated generations of leaders, advanced groundbreaking discoveries, and developed solutions to protect and improve the health of people in this country and around the world. The school boasts 16,000 alumni, 378 faculty, and more than 1,300 current graduate students from 55 countries. It is home to celebrated departments and research centers like ICAP, the Center for Infection and Immunity, and the Robert N. Butler Columbia Aging Center. Over the course of the last century, the practice of public health has flourished, adding 3 decades of lifespan in the United States and globally through efforts to prevent disease, disability, and injury at every stage of life. Today, public health experts are at the forefront of efforts to address the biggest challenges facing our world, from the health effects of the climate crisis and food insecurity to health inequities and pandemic preparedness, prevention, and response. Recent events have demonstrated better than any lecture ever could just how indispensable this work is to the safety and security of our global society. Throughout the COVID-19 crisis, experts from Columbia Mailman and from schools of public health across the world have been on the front lines. They have been doing the research, offering guidance to governments, and educating the public on the most urgent and timely issues of the pandemic as it evolves. We're here today at this World Leaders Forum event to celebrate 100 years of the Columbia Mailman School with a conversation between Dean Linda Fried and Director General of the World Health Organization, Dr. Tedros. They will discuss the lessons of COVID and what we must do to identify and prepare for public health threats in the future. It's always a great honor whenever Dr. Tedros joins our university community. His first visit came in 2017, shortly after he became Director General of WHO, and he was here for last year's symposium on vaccines and global health. He has been a strong and thoughtful voice throughout this pandemic, most recently in support of equity and access to vaccines for nations across the globe. Linda Fried is Dean of the Mailman School of Public Health and De La Mare Professor of Public Health Practice. She is an expert in the fields of epidemiology and geriatric medicine and director of the Robert N. Butler Columbia Aging Center. Dean Fried deserves our admiration and thanks for her leadership of Columbia Mailman for the last 13 years, and particularly over the course of the last 18 months. Please join me now in welcoming Dr. Tedros and Dean Fried. Thank you.
To join Dr. President Bellinger in welcoming you today, to thank you for your leadership and for this conversation right now on the import of strong global public health as a foundation for successful societies. So thank you. I'd like to start with that theme of what public health means as a public good, and what the root causes are from your perspective that impede the world benefiting from its full import. For background for our audience, many are familiar with the work of Adam Smith, an unlikely person to bring up in this conversation. Adam Smith, of course, was the father of capitalism. But I think that many people forget that Adam Smith in his writings also emphasized the importance of societal investment in public goods. He pointed out education and roads and public safety, but said that public goods are critical societal investments, investments that no one entity can profit from, but every person and entity of societies gain from. And it's clear that in that context, both the creation of health and public health itself could be considered public goods. Now, public health as a public good has not been the clear frame in the conversation in many sectors during this pandemic, and yet the WHO Constitution uses language to explain its public good responsibilities, the promotion and protection of health, because it's of value to all and essential to peace and security, and that it is dependent on the fullest cooperation of individuals and states, and that unequal promotion of health in different countries is a common danger. With that background, Dr. Tedros, would you please speak to us about the role of WHO and of public health generally as a public good, and what the challenges are to accomplish that public good for everyone?
Thank you so much. President Lee Bollinger, Dean Linda Fried, Dean Faculty, students, from celebrating the centenary of the Mailman School of Public Health. When your forebears at Columbia University made the decision in 1914 to formalize the science, education, and practice of public health, they cannot have known that a global influenza pandemic was just around. As President Bollinger said, some of you may remember the last time I had the privilege of addressing the World Leaders Forum in 2017. And that was after I became DG, the first and major speech I made. And I told the 1918 pandemic without knowing that the 2019 pandemic was around the corner. And I said that despite our more recent experiences with SARS, H1N1, and Ebola, the world was still unprepared for another pandemic. Although much has changed since 1918, much hasn't. People then were having many of the same debates that have been had around the world in the past year, including whether to keep schools open during the pandemic. New York's director of public health for schools was Dr. S. Josephine Baker, and she made the case for keeping students in school, as many students lived in crowded tenement conditions with poor ventilation and little access to health care. In school, they would be in a healthier environment, could be monitored for illness, and if necessary, be given free medical care. Dr. Baker convinced Dr. Royal Copeland, the head of the city's health department then, which enjoyed public trust from its handling of cholera and TB epidemics in years past. It worked. New York fared better than other large cities that kept their schools closed. I'm not saying whether I think schools should be open or closed now. That depends on the local situation based on a careful risk assessment. The point is, that's exactly what Baker and Copeland did. They made a risk assessment based on the data they had, and the measures they took were successful in part because of the level of public trust they enjoyed. Columbia's own public health historian, Professor David Rosner, said this: with no ability to see the virus and no vaccines available to prevent its spread, the public health community's ability to fight the epidemic depended on its moral, political, and legal authority. That was 1918. 100 years later, we might have vaccines, but a lack of moral, political, and legal authority has fueled the COVID-19 pandemic. Even some of the world's wealthiest countries with the most advanced medical systems have been overwhelmed. Trust in science and scientific institutions has been frayed by years of politically motivated attacks. Geopolitical fault lines have been exposed and widened, and the inequalities and inequities that lie at the root of so many public health challenges have fanned the flames of the pandemic. The global vaccine crisis is Exhibit A. More than 6 billion vaccine doses have now been administered globally, and almost 1/3 of the world's population is fully vaccinated against COVID-19. But those numbers mask a horrifying inequity. More than 75% of vaccines have gone to high and upper middle income countries. Low-income countries have received less than half of 1% of the world's vaccines in Africa. Just 4% of people are fully vaccinated. WHO's targets are to vaccinate 40% of the population of every country by the end of this year, and 70% by the middle of next year. These targets are eminently achievable, but only if the countries and companies that control the global vaccine supply do their part. We need a global realization that no country can vaccinate its way out of this pandemic in isolation from the rest of the world. The longer vaccine inequity persists, the longer the social and economic turmoil will continue, and the more opportunity the virus has to circulate and change into more dangerous variants. It was in my speech at the World Leaders Forum in 2017 that I first said, no one is safe until we're all safe. It was true then, and it's even more true now. We're grateful that high-income countries have pledged to donate more than 1 billion doses, but so far, less than 15% of those doses have materialized. We call on the countries and companies that control the global supply of vaccines to swap their near-term vaccine deliveries with COVAX and Abbott, to fulfill their dose-sharing pledges immediately, and to facilitate the immediate sharing of technology know-how and intellectual property for local production. Even as we work to stop transmission, save lives, and end the pandemic, we must learn the lessons it's teaching us. As you know, there have been several reviews of the global response to the pandemic and of WHO's performance, with many recommendations for making the world safer. As we have studied these reviews, we see 4 key areas for action. First, we need better global governance. The existing global health security architecture is complex and fragmented, and voluntary mechanisms have not worked. A treaty or other international instrument on pandemic preparedness and response will provide a much-needed overarching framework for global cooperation, setting the rules of the game and enhancing solidarity among nations. This will be the subject of a special session of the World Health Assembly in November. Your voice in supporting pandemic treaty or agreement will be very important. Second, we need better financing for national and global preparedness and response. That includes a substantial increase in domestic investment as well as in international financing to support low and lower middle income countries for surveillance, laboratories, risk communication, and contact tracing, preparedness systems using a One Health approach. Crucially, we need to recognize that global health security begins with local health security, which means we need investments in strong primary health care at the foundation of universal health coverage. That means a well-paid and well-trained health workforce with adequate protective equipment and supplies and facilities for hand hygiene. And it means a health system that has earned the trust of the communities it serves, including in disadvantaged urban and rural areas. The strong primary health care is an essential first line of defense against outbreaks, but also against other communicable and non-communicable diseases, and for the health impacts of pollution and climate change. Third, we need better systems and tools to detect, prevent, prepare for, and respond rapidly to outbreaks. Already, WHO and our partners are putting many of those tools in place. Earlier this month, I was honored to join German Chancellor Angela Merkel to open the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, a new center designed to foster greater sharing of data and information between countries and to improve global surveillance for epidemics and pandemics. This will be a very important early warning system. Other initiatives are in development, including the WHO BioHub, a new facility in Switzerland for storing and sharing pathogens, and the Universal Health and Preparedness Review, a new peer review mechanism for enhancing national preparedness. Recently, WHO also announced the establishment of a permanent international scientific advisory group for origins of novel pathogens, or SEGO, to establish a more systematic way of identifying the source of new outbreaks. And just this week, I was honored to join President Emmanuel Macron for a groundbreaking ceremony of the new WHO Academy in Lyon, which will use state-of-the-art technologies to expand worldwide access to lifelong learning for health workers and public health professionals all over the world, with a global center for simulation in emergency preparedness and response. And fourth, and underpinning all of this, we need a stronger, sustainably financed and empowered WHO at the center of the global health architecture. With 194 member states and 152 country offices, WHO has unique expertise, a unique global mandate, unique global reach, and unique global legitimacy. In the coming months and years, Other crises will demand our attention and distract us from the urgency of taking action now. If the world continues down the same path, it will continue to get the same result, which is a world that's less healthy, less safe, and less fair. 100 years since the founding of what's now the Mailman School of Public Health, the research you do and the education you provide are more important than ever for New York City, the United States, and the world. Because above all, the pandemic has taught us that health is not a luxury, but the foundation of social, economic, and political stability. Health is not a cost to be contained, but an investment to be nurtured. And health is not a privilege, but a fundamental human right. I wish everyone at the Mailman School of Public Health a very happy birthday. May the next 100 years be even more productive as we work together in solidarity for healthier, safer, and fairer future for everyone, everywhere. Thank you very much for your contribution and dedication, not only to the US, but global health, as I said, and happy birthday. Back to you, Dean.
Thank you so much, Dr. Tedros. And I appreciate the birthday greetings and also recognize that our aligned and dual commitment to the public's health is part of a global architecture that is critical for everyone. I appreciate so much the points you have made, which are critical for the future. And, recognizing, articulating so well that when it comes to health, as you have said before, our destinies are intertwined. And as you pointed out, what we've seen so much in this pandemic is that not only are our destinies intertwined in terms of health, but for example, the pandemic has made clear that health and the economy are inextricable. That the global economic losses continued now due to delayed vaccinations and may run into the trillions of dollars if low and middle income countries cannot quickly vaccinate their populations. And we are anticipating the long-term economics of the widening inequities that you spoke to might be the principal fault line along which the global economic recovery is diverging. So I so appreciate the points you have made about the critical need to assure that everyone in the world has the access to vaccines. Thank you. I'd like to perhaps also deeply recognize your point about the need to strengthen the moral, political, and legal authority of public health as a public good. And the proposals that you've just put forward for strengthening global governance for our intertwined destinies has to be, of course, as you said, foundational to that. If I think about not just the global architecture across the 194 nations of member states of the WHO, I'd be interested also in probing your thoughts about public health functions and how we strengthen our collaborative relationships between public health, national public health bodies and the WHO specifically, and the global role so that together we contribute to the public's health optimally. Could you amplify your comments in terms of how we need to see nations collaborating differently with the WHO going forward?
No, thank you. Thank you so much. As you know, WHO has the mandate to convene, and we work with all member states, 194, and also territories in order, to have a common position on responding to common threats. But when we talk about the global cooperation, I think the key here is to have strong national capacity. It's when there is, as you said, public health is central, and when there is a strong public health system in each and every country, then there is a strong global preparedness. So that's why the partnership or the convening between WHO and all the countries is very, very important. First, to build, the national capacity. And when you build the national capacity, to build it around common basic principles. So there is alignment that can help us to fight, or to respond as a international, as a community. So that's one. So it's the national capacity building, and then that helps the global. At the same time, the work with public health bodies helps us to get information, which is very vital to identify any risk or threat as early as possible. For instance, in this pandemic, we have seen that there are some, weaknesses, and that's why we have now proposed the Berlin hub, which is part of WHO, but which will forge relationships not only with governments but with academic institutions, with non-governmental organizations, and any relevant body that can contribute in terms of sharing information. So there is no loophole or crack where we lose information, or where there is delay to pass the relevant information. If you like, it's an early warning system. So coming back to your question, our relationship with global health bodies, beyond even the governments, can help us in making sure that we have a wider network to contribute to an early warning system. So that's very important, and the reason we have the Berlin hub now. And then the third is, be it to strengthen national capacity or to have global preparedness like simulations. We have the Lyon, which is the Lyon WHO Academy, which will be the global center for simulations, especially in emergency preparedness and response, that can help us to build capacity at country level and also global levels. So these are some of the examples, but working with the public health bodies of countries and even beyond, I think will be very important, given the experience that we have already with COVID. And we have already started many new initiatives to make sure that the relationship between public health bodies and WHO is strengthened, and there is a strong preparedness at country level and strong preparedness globally as well.
Thank you so much. This really develops out something else you've said often, which is that the right to health is not a job for one organization or leader, but a job for every single one of us together.
Yes.
I'd like to draw on two other things that you mentioned in your opening remarks. You mentioned climate change and its impact on health, and you mentioned the need to build, in the context of the COVID-19 pandemic and prevention of future pandemics, to build a One Health approach. I wonder if you could expand on that so that our audience understands both what you mean and how you think a One Health approach needs to transform public health approaches generally.
Mm-hmm. Yeah, thank you. Thank you very much. That's very important. In preparing for the future, I think we have to learn from all the lessons that this pandemic is giving us. And as you know, there have been many panels, starting from the IPPR, which I had the opportunity to establish the panel, and also other high-level panels have recommended, for better future preparedness, many recommendations actually. And one of which is the One Health approach, which of course, even before the recommendations, it was obvious and we started working on it, and there is already a unit which is coordinating the One Health approach. In One Health approach, it's not only the human health, but it's the animal health plus the environment, all three that really can bring, zoonosis or emergence of a new pathogen, and the collaboration of all sectors who are involved in One Health, which is very crucial. So that's why if you take the UN agencies, we're now partnering with Food and Agriculture Organization, with Organization of Animal Health, and with the UN Environment Program. So this is the UN coming as one to address health through all important elements of the agency. But at the same time, at country level, there should be the same collaboration between the three major or the four major stakeholders. So that's the whole idea, and that can help us if you focus in all these areas, including the animal health. It can help you to detect threats as early as possible. And you can if you detect it as early as possible, means you can also manage it. But not only that, not about detecting, but it's also about preventing. So in terms of animal health, be it wild or domestic, you will take all the measures that you should take to prevent any transfer of pathogens from animals to humans. And there are many examples. By the way, we're working closely together now on wet markets. And if you take, especially in the Mekong region, because of the traditions, there is a serious actually threat of pathogens jumping from animal to humans, which may come as a threat in the future. So that's the whole essence. But not only the global cooperation, applying it at country level will be the most central to prevent emerging diseases in the future.
So one final question before we turn to our virtual audience. I feel like we would be remiss if we didn't focus on another consequence of the pandemic, which is the consequences to the long-term health of populations because of perhaps unitary focus on COVID-19 prevention and response, and the consequences in terms of the other health issues that people have that can't be put on hold while there's a pandemic. Can you talk to us a little bit? Clearly, COVID has preyed on the vulnerable, especially those who are older and those with poor health status. can you just talk to us about, beyond the illness and mortality of COVID itself, what has COVID done to the general health status of nations?
What COVID done to tell me that?
What has while we have been trying to manage COVID, there have been a lot of fallout in terms of worsening health for populations in other ways, in terms of chronic diseases, care not received. How do we think about that going forward so that we can both manage and prevent future pandemics while also elevating the health of populations?
Yeah, no, thank you very much. You're right. COVID-19 has disrupted, other health services, and also some of the major, health problems, both in developing countries and developed countries, have actually deteriorated. For instance, deaths due to malaria, deaths due to TB, HIV has actually increased in developing countries where malaria, HIV, and TB is endemic. But not only that, non-communicable diseases also. So the disruptions can be seen in terms of morbidity increase and in terms of mortality. Not only that, the impact on mental health services was also high. And it was even COVID contributed to even have more mental health challenges. So, as you rightly said, there should be a balance when you fight a pandemic. The disruption to other health services should be minimized. When you save people from COVID, they shouldn't die because of other illnesses, and that's what happened. And now we're working with countries to keep that balance. It's a matter of striking a balance between other services and managing COVID. And we see good progress in many countries. And it will be a good lesson going forward also in the future on how to balance, response to emergency, but at the same time, providing the other services and saving lives. Otherwise, save lives from COVID and they die from non-communicable or malaria or TB, then it's no. So that's what we're trying to do, and we're documenting the lessons from this pandemic on how to keep balance. And by the way, one thing that we need to invest for the future is the technology. Digital technology will be very important. It can address many of the, disruptions and the, lack of access that we see, or minimized lack of access because of COVID. Some countries have been bringing digital health services to compensate. So there are, I think, for the future, digital health can take more share in keeping the balance. But at the end of the day, it's a matter of a balancing act.
Of course, WHO is leading on so many things that are critical to our future, and there isn't time to get into all of them today. But one dimension, I think, of your leadership in declaring 2020 to 2030 to be the decade of healthy aging also addresses how to keep people now living longer lives with health, which is another bulwark as we accomplish that globally to prevent diminishing vulnerability to novel infections. And so there are so many intersections between the different areas of WHO's leadership, and we're all deeply grateful for that. It's my privilege now to turn to our virtual audience, and we have a number of students who are eager, Dr. Tedros, to ask you questions. So I'll turn to the first question.
Dr. Tedros, thank you for your insights today. My name is Chris Henderson. I'm from New Zealand and a doctoral fellow in the Humanitarian Affairs program at Teachers College, Columbia University. As your remarks confirm, we have a long way to go until we exit from this current pandemic. But looking towards the future, how do education systems globally plan for and prepare for the prevention of the next pandemic? And associated with that, how central do you think education systems are to global public health?
No, thank you. Thank you very much. I mean, that's a very good question and very, very important one. I mean, I will undermine that question if I just say this is the answer or easy answer. I would like to suggest one thing. As I said earlier, we're learning a lot from this pandemic, and we have to put together everything that we're learning from this, and that learning should contribute, or the recommendations we get from this, from our learning process to reform our education system. So that's what I would say in general. And I would like the education sector to really take it seriously, and would be happy, by the way, to convene even a meeting. What are the lessons here? And what could be the contribution of the education system? Not only in educating our new generation, but in addition to that, even participating in the preparedness, starting from prevention, early detection and response. For instance, in the Berlin Hub, I said it earlier, the network will be a mega network that brings all institutions that can contribute to be part of that network. And public health institutions can, be part of the network to share information and, have a robust system that can be able to detect, any outbreaks as early as possible. So I would leave it at that. But I think your question triggered actually an opportunity that we need to convene a meeting to see what the lessons are and discuss about the lessons and see how that could impact the education system and shape our education system based on the lessons learned. But sure, I cannot even finish if I start listing many of the things that the education system will do, starting from a very strong public health, schools. Many countries, including the high-income countries, were surprised. They didn't have even people to do contact tracing. Testing centers were not sufficient. Testing was taking days or maybe weeks in some countries. And testing, contact tracing was absolutely dead. They couldn't do it. So I think public health schools will be very, very important. And you will be able to address this. So countries will be ready. Otherwise, public health was completely neglected, by the way, even in high-income countries. That's a big lesson from this pandemic. Less developed countries, by the way, did better in terms of testing and contact tracing, not high-income countries. So I think the public health schools and the whole education system should really learn from this and contribute to future preparedness. That's what I would like to say. And I would be happy to keep in touch with you and maybe convene it together, since you have that question, and discuss about how the contribution of education systems will be to the preparedness and response.
Thank you to both of you. I'll turn now to our second question.
Greetings, Dr. Tedros. My name is Yaroslav Kalyahan. I'm a development practitioner from Kazakhstan, graduated from Columbia's Master of Public Administration in Development Practice program. And the pandemic was truly challenging for people across the world. And I wonder, how global efforts to combat the disease and investments and attention to healthcare at large affected the research and development of other diseases, like what healthcare trends did it reinforce, and other things that we should be excited about. Thank you.
Can you reframe that question? Sorry, and Rahmat, I'm sorry again to ask you. By the way, I have some part from some stories about Kazakhstan, but I will talk to you some other time. Rahmat, but can you reframe it a bit?
So I just wonder if all the attention to healthcare investments and research that has been done in regards to coronavirus, did it affect some new breakthroughs for other diseases? Are there any novelties and in general, are there any positive trends that we could see from this challenging issue about the pandemic?
Yeah. No, thank you so much. Yeah, thank you, Rahmat. I think I can give you some, but one of the important ones is we were able to have a vaccine in less than a year. That's very historic, by the way, and a record. And not only in less than a year, but the technology also, mRNA. I think mRNA technology can be used is used for COVID, but for coronavirus, it can be used for other diseases as well. It has a huge potential. I think it's the technology of the future in terms of vaccine development. So that, I think, is a contribution and a blessing in disguise. And of course, there are many other things, but I would take this as one very important milestone. Thank you.
Thank you both so much. May I have the next question, please?
Hi, thank you, Dr. Tedros, Dean Fried in Colombia, for the opportunity to ask my question. My name is Joanne Michelle Fernandez Ocampo. I'm a Norwegian Filipina here in New York. I'm a DRPH, or Doctor of Public Health student here at the Mailman School of Public Health. Dr. Tedros, my question. So over recent time, we've seen increased public dismay and difficulties with trust in global health and political leadership. So I was wondering, how do we, the next generation of public health leaders and global health practitioners, prepare ourselves for these challenges ahead? What do you wish you knew going into this role that you didn't know then about what it means to be an effective global health leader today? Thank you.
Yeah. Tusen tak. Yeah, no, that's a very important question. Trust in global health. But its roots are actually trust in political leaders, to be honest. From the start of the pandemic, we have been saying, in order to fight this pandemic effectively, we need national unity and global solidarity. But that has not been happening, and it's not happening now. As you said, I just brought one example, vaccine nationalism. It's not happening. Vaccine equity is not happening because of vaccine nationalism. And there is this me-first approach, although, as Dean Fried said, public health is a global public good, and no one can be safe until everyone is safe, and everybody should use the products we have in order to be safe as a community. So the failure comes, whether it's the vaccine equity or even the debates at national level, whether they should, about wearing a mask or other things, politicization of even the technical things. It's because of political failing. And maybe if I can give you, I was a politician myself, one of the root cause of the problem is our political leaders are not thinking beyond the next election. So they will do everything to satisfy their constituency so they don't lose the next election. Even if it means, their behavior is going to help the virus to spread. I'm sorry to say this, but that's the problem. And there is this, what they say, all politics is local. And it's true. And if you see it nationally, that's what the behavior of many leaders we have seen. Instead of political parties coming together to fight this pandemic together, they were making it a political issue to punch each other. But for political leaders to compete, there are many other things that they can compete with. The pandemic fight against this pandemic should have been a common ground and even fight it together. Should have been they should have a bipartisan position. You don't see that. And then the fragmentation because of politicization at national level is reflected at global level too. Then there is no solidarity also at global level. So I think, I don't want to go into other reasons, but if you ask me, just one reason is the politicization of science. And instead of using science and solutions and solidarity to fight this pandemic, the politicization and the scoring for their political ambition, maybe the next election, has been complicating the fight itself. So going forward, the new leaders, I think I cannot be unrealistic and say don't think about your constituency or the next election. You can, but at the same time, the common goods that should be done that can bring better outcomes in terms of fighting a pandemic, a political leader should stand firm, saying to its constituency, this is good for you if we also work with other countries. It's good for you if we share vaccines, because it's in the interest of our own national interest. It's our own international national interest if we share and fight this pandemic together with the rest of the community. So we need you, the future leaders, to be thinking beyond the next election. So you can do your election, fine, but at the same time, you can stand firm and do things that are better for the global community and the right things to do and bring national unity at home and global solidarity. I can give you one example. Many countries have done it, but if you take Finland, the political parties formed a common committee and were working together. And there are other countries also, I can give examples, and that really helped. So can we do that? When there is a common enemy like virus, which exploits our, the cracks between us, whether it's national or global level. So trust in global health without addressing the problems we see in political leaders, it will not happen. So you're the future of global leaders, political and health, global health. So that's where you should make it right. When politics is right, it will be okay, the global health also.
Thank you both so much. We can take the next question, please.
Hi, Dr. Tedros. My name is Michaela Kamosi, and I'm a first-year student at the Mailman School of Public Health. What experiences or skills best prepare you to lead the WHO? Thank you.
Yeah, I think it was not planned. And when I ran for the first term, I was not really taking it seriously. So some people gave me a name saying the reluctant candidate. So I don't know if there was anything to prepare. It just, maybe I'm lucky and came just randomly. But looking back, I think the training in public health helps, but at the same time, the other experiences I had as Minister of Health, which also helped. And also I worked in the foreign affairs, international relations, probably that helped. So a combination of all this could help. Of course, public health is central, that's the central one. the rest could be an added value. But I never planned for myself to be a minister. I was a minister. I never planned to be a DG. I became a DG. I don't know how it's happening. It just happens. But you may not not understand that, but that's what happened. But the only thing I do is put me in anything. I do anything or do everything I can in good faith and go wherever that takes me. But at least in terms of education, though, what I'm saying is you need to prepare public health and other relevant, but there are other opportunities also that you may have in life that can help you to prepare, because it's not just the narrow public health alone. So you can prepare yourself by having a wider experience in your life.
Thank you so much. So now for our last question.
Hi, I'm Sarah. I'm an undergrad at Barnard College. I'm also a student journalist for blog. I'm the science editor. My question was, we have reasons to, we know that vaccine equity, the state of vaccine equity right now is rather dire, that we talked about vaccine nationalism and lack of access. Are there any reasons to be hopeful for the future of vaccine equity, if not for COVID vaccines, for future vaccines or current vaccines? Thank you.
Yeah. So thank you. For vaccine equity, I think we can be hopeful, especially with technology, and especially there are now interests from the developing countries, from the South also, to have local production. But of course, the North should be willing to provide technologies. So technology transfer will be really key. And WHO partnered with some organizations to establish a hub in South Africa. It's based on mRNA technology, and local production in the South could help. And we're also partnering with many countries, not only South Africa, but with Brazil, for instance, from Latin America, but there are other countries, but that's could be a major hub. And you have India and also Indonesia. We're working with them. From African countries, not only South Africa, we have Senegal, Rwanda. I think the production capacity that we can have in different countries can address vaccine equity in the future. That should be the strategic solution. And so that's one. And the second is pandemic. By the way, even if you do that, the number of countries that will produce vaccines still will be small. I mean, every country cannot produce vaccines. The reason we're pushing for pandemic treaty is to have some obligation. So there will be provisions in the pandemic treaty that can address banning of exports like raw material that we have seen now from some countries that contributed negatively to production, and also even banning exports of vaccines, which is another problem. So having the pandemic treaty can also maybe contribute in the future to vaccine equity. So it's local production and some laws or some framework or agreement or treaty that can guide us in the future. So that's I'm hopeful that it could be better in the future.
Thank you so much, Sarah, and Dr. Tedros. Thank you so much for these very important insights and comments, and again, for your such important leadership. Just to try and add a few closing remarks, the WHO Constitution of 1946 states very clearly that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. And the responsibility of WHO is to lead collaboration towards the public good of health for all. I think you have laid out a compelling case today about why countries and our world need to reinvest in public health as the foundation for successful societies, a critical foundation. And we're grateful for what you have laid out today. We also recognize that many of the issues that you have brought up, in addition to increasing risks of pandemics, have to be led together across the world, whether it's prevention of chronic diseases, how we create health across our full, now longer lives, or how we mitigate what we thought a dozen years ago was science fiction, but now is very clearly the disastrous health impacts of climate change. All of these, we all know, are global issues that will require global as well as local solutions. And we look forward to, of course, from Columbia to supporting our global work together in any way that we can, and appreciate so much the success of WHO in creating the global community we need. Thank you so much for being with us today. We're deeply grateful.
Thank you so much. It's a great honor for me too. So thank you so much indeed for the opportunity, and look forward to be in Columbia University in person in the future.
That would be wonderful. Look forward to seeing you then. Thank you to our audience.
A bit sick and tired of the Zoom, huh?
Yes. In person is better. So I'll look forward to that as well, and perhaps in person with many of the people online with us today. Thank you so much.
Thank you. Thank you so much. Bye-bye.
Take good care.
Thank you.
Thanks to all. Bye-bye.
Bye.